Today we're going to dive into one of the most tragic and eye-opening events in pharmaceutical history, the thalidomide tragedy. This story involves a seemingly miracle drug that turned into a nightmare, affecting thousands of families across the world. We'll explore the science behind the drug, the devastating effects it had, and how this scandal forever changed the way drugs are tested and regulated. Let's begin. In 1957, the German pharmaceutical company Chemie Grünenthal introduced a drug that would be prescribed to millions: thalidomide. It was marketed as a safe, over-the-counter remedy for morning sickness, especially for pregnant women. Thalidomide quickly gained popularity across Europe, Australia, and other parts of the world. Mothers suffering from nausea and sleeplessness believed they had found a solution. But what they didn't know was that this so-called wonder drug would soon become one of the greatest medical disasters of the 20th century. While thalidomide was approved in 1957, drug testing regulations back then were far more relaxed than they are today. It was promoted as safe, even though the full effects on pregnancy hadn't been thoroughly tested. By 1958, doctors began noticing a disturbing trend and increase in the number of infants being born with severe birth defects. Babies were born with malformed limbs, brain damage, and in many cases multiple organ failures. At first, doctors couldn't understand the cause of this surge in cases. But then two doctors, V.T. Can-Lenz in Germany and William McBride in Australia, made a groundbreaking discovery. They realized that all the affected mothers had taken thalidomide during their pregnancies. By 1961, they had proven the link between the drug and these catastrophic birth defects, forcing thalidomide to be pulled from shelves worldwide. So what made thalidomide so deadly? The answer lies in its chemistry. Thalidomide is what we call a chiral molecule. Essentially, it exists in two mirror image forms, known as enantiomers. These are like your hands. They look similar, but they aren't identical. In thalidomide's case, the R enantiomer was effective in reducing morning sickness, but the S enantiomer was the dangerous one. The S form attacked developing fetuses, leading to the devastating birth defects we saw. Even more terrifying, inside the human body, the safe R form could convert into the deadly S form. This meant that even if scientists tried to isolate the good version of the drug, it would still turn harmful. Over 10,000 children worldwide were born with these defects, and nearly 40% of them did not survive past infancy. The fallout from the thalidomide tragedy was global. Lawsuits were filed, and the German pharmaceutical company Chemie Grünenthal faced widespread backlash. Countries like Germany and the UK were heavily criticized for being slow to act, while in the US, the drug narrowly avoided approval thanks to the caution of FDA scientist Dr. Francis Kelsey, who demanded more data before giving it the green light. This disaster forever changed drug regulation policies. Governments around the world introduced stricter laws for drug testing, ensuring that no drug could ever again be marketed without extensive trials, especially for pregnant women. The thalidomide tragedy is a powerful reminder of the importance of rigorous drug testing and ethical responsibility in the pharmaceutical industry. While it has been over 60 years since this disaster first unfolded, its effects are still felt by the survivors and their families today. Thank you for joining me on this deep dive into the thalidomide story. If you found this video informative, be sure to like, comment, and subscribe. And as always, stay curious and informed. Thanks for watching, and I'll see you in the next video.